Dr. Wayne Saunders and the Center for Oral and Maxillofacial Surgery at St. Luke's has been the leading oral surgery practice in the Lehigh Valley for well over a decade. The center started as a solo practice and has now grown to 4 locations with 8 incredible doctors.
I'm Dr. Wayne Saunders. I am an oral surgeon and the founder of the Center for Oral and Maxillofacial Surgery at St. Luke's. I started the practice in Bethlehem about 12 years ago. I was originally practicing in New Jersey after I finished my residency in New York City and wanted to start my own practice. My father was a doctor at St. Luke's for the last 30 or 40 years and expressed that there was a need for oral surgery in the Lehigh Valley, specifically someone to cover facial trauma for the St. Luke's system, as they recently just became a level 1 trauma center. So I came up and I looked around and talked to the people at St. Luke's, and they were warm and welcoming and asked if I would start a practice, and I said I would, and I said I'd cover their facial trauma. And that's how it all started. It was myself and a few ladies, and we started from scratch. And we've grown tremendously over those last 12 years now.
At the Center for Oral and Maxillofacial Surgery, the doctors practice a full range of oral and facial procedures, including dental implants, all on 4 bridges, bone grafting, tooth extraction, including wisdom teeth removal, facial trauma, jaw surgery, in-office IV sedation, and general anesthesia, along with cosmetic procedures such as Botox and Juvederm. In addition to in-office procedures, the doctors at the Center for Oral and Maxillofacial Surgery are on staff and on call for facial trauma needs at St. Luke's University Health Network.
I'm a big believer on treating the person, not the condition. I think it's very important to treat everybody, every patient as they're your family. I think it's important for many reasons, but most importantly, I think you do a good job. You can sleep at night knowing that what you did was right and what you're doing you felt was right to the bottom of your heart. So I look at every patient as they're my kid sitting in that chair. And would I do that surgery on them? Is this how I'd handle the situation? And if I wouldn't do it for my own child, I wouldn't do it for my patient.
I'm Kat Aducci, and I am the marketing manager for the Center for Oral and Maxillofacial Surgery at St. Luke's, or more commonly known as St. Luke's OMS. When patients come into our office, they're going to be having fun. They're going to feel as though they're in a comfortable environment. All of our employees do their best to make the patients feel comfortable. You know, oral surgery is at times the last resort. Oral surgery can be a very personal and very emotional surgery that patients need to have. You know, a smile is very special. It's the #1 thing you see, you know, any type of emotion, laughing, smiling, you know, crying even, everyone is looking at your smile, and it's something that's very personal. So when patients come in needing to fix their smile, it can be emotional. So I pride myself in the fact that I work for a practice that has employees that make patients feel comfortable.
Many people come in frustrated, in pain, uncomfortable, and it's our job not just to get the tooth out or to replace the tooth with an implant, but to make them feel comfortable and let them know that we're going to help them. For me, the most rewarding part of doing what I do is meeting people. I'm a people person. I like to talk to my patients. I like to get to know them, and I consider them friends as we work through their problems.
We make every effort to provide you with the finest surgical care and the most convenient financial options, including many different insurances. To accomplish this goal, we work hand in hand with you to maximize your insurance reimbursement for covered procedures.
Certainly this is a business. Certainly we have expenses to cover and staff to pay and electric bills and rent like everybody else. But I approach my practice in the respect that I want everyone to understand what they're getting themselves involved in. I never want us to tell somebody that your insurance is going to cover this, your out-of-pocket expense is this, and it ends up being something else. So one, we stand by anything that we tell anybody. If we're able to make it a little bit more affordable, I just felt it was important to reduce the fees enough where people could do it, and it wasn't so burdensome for the patient if they needed to do it.
Something unique about St. Luke's OMS is that we have an actual billing department. So you're not going to have people who are checking you in, also going over details of your insurances with you. We have our own department for that. They're going to be talking to people who are familiar with their case. They're not going to have to consistently explain their financial situation over and over again to different employees. They're going to be talking to that one person who is handling all of their billing.
Dr. Saunders and his incredible team is proud to bring this quality of health care to the area and takes pride in the practice's ability to give people back their smiles.
Everything's feeling good, comfortable.
St. Luke's OMS not only cares about their patients, but also about the community.
I started a general practice residency at St. Luke's Hospital, which incorporates now a dental clinic, where we offer free as well as Medicaid type services to the community in South Bethlehem. We help staff that as well. We help cover that. We also do some of the local dental charities, Kids Peace, and other things that we feel that we need to give back and help the community.
At St. Luke's OMS, we want patients leaving knowing that they made the right choice in choosing us as their oral surgeon. We don't want anybody leaving with a doubt in their mind that they had received the best care, the friendliest care, and the most personal care that they could have received. We want everyone to want their smiles to say St. Luke's OMS.